नमस्ते बिटिया, हमेशा खुश रहो बिटिया। I am Dr. Bharat Sharma, Assistant Professor, Department of Pathology, Faculty of Homeopathic Science, Jyoti Vidyapeeth, Women's University, Jaipur. Today's topic is thrombosis. Thrombosis is the process of formation of solid mass in circulation from the constituents of flowing blood. The mass itself is called a thrombus, a term commonly used erroneously. Synonyms with thrombosis is blood clotting. While thrombosis is characterized by events that essentially involve activation of platelets, the process of clotting involves only conversion of soluble fibrinogen to insoluble polymerized fibrin. Clotting is also used to denote coagulation of blood in vitro. Example is in a test tube. Hematoma, hematoma is the extravascular accumulation of blood. Example is into the tissue. Hemostatic plug are the blood clot formed in healthy individuals at the site of bleeding. Example in injury to the blood vessel. Thrombi developing in the unruptured cardiovascular system may be life-threatening by causing one of the following harmful effects. First is ischemic injury. Thrombi may decrease or stop the blood supply to part of an organ or tissue and cause ischemia, which may subsequently result in infarction. Second is thromboembolism. Thrombus or its part may get dislodged and be carried along in the bloodstream as embolus to lodge in a distant vessel. Pathophysiology. Human beings possesses inbuilt system by which the blood remains in fluid state normally and guards against the hazards of thrombosis and hemorrhage. However, injury to the blood vessel initiates hemostatic repair mechanism or thrombogenesis. Virchow described three primary events which predispose to thrombus formation, also known as Virchow's triad. These are endothelial injury, altered blood flow, and hypercoagulability of blood. To this are added the activation process that follow these primary events, activation of platelets and of clotting system. First is endothelial injury. The integrity of blood vessel wall is important for maintaining normal blood flow. An intact endothelium has the following functions. It protects the flowing blood from thrombogenic influence of some endothelium. It elaborates a few antithrombotic factor, thrombosis inhibitory factors. Examples are heparin-like substance, thrombomodulin, inhibitors of platelet aggregation, and tissue plasminogen activator. Third is it releases a few prothrombotic factors which have procoagulant properties. Thrombosis favoring factors. Examples are thromboplastin, von Willebrand factor, platelet activating factor, and inhibitor of plasminogen activator. Vascular injury exposes the subendothelial extracellular matrix or ECM. Examples are collagen, elastin, fibronectin, laminin, and glycosaminoglycans, which is thrombogenic and thus play an important role in initiating homeostasis as well as thrombosis. Second is role of platelets. Following endothelial cell injury, platelets come to play a central role in normal homeostasis as well as in thrombosis. The sequence of events is as under. First is platelet adhesion. Glycoprotein LB receptor on the platelet recognize the site of endothelial injury and the circulating platelets adhere to expose endothelial ECM primary aggravation. Second is platelet release reaction. Activated platelets then undergo release reaction by which the platelet granules are released to the exterior. Two main type of platelet granules are released. First is the dense bodies and second is alpha granules. Now third, platelet aggregation. Following release of ADP, a potent platelet aggregating agent, aggregation of additional platelet take place, also known as secondary aggregation. Now third, role of coagulation system. Coagulation mechanism is the conversion of the plasma fibrinogen into solid mass of fibrin. The coagulation system is involved in both hemostatic process and thrombus formation. In the intrinsic pathway, contact with abnormal surface, example extracellular membranes in the subendothelium, leads to activation of factor 12 and the sequential interaction of factor 9, 11, 8, and finally factor 10, along with calcium ion factor 4 and platelet factor 3. In the extrinsic pathway, tissue damage results in release of tissue factor or thromboplastin. Tissue factor on interaction with factor 7 activates factor 10. The common pathway begins where both intrinsic and extrinsic pathway coverage to covered converge to activate factor 10, which forms a complex with factor 5a and platelet factor 3 in the presence of calcium ions. This complex activate prothrombin factor second to thrombin factor second A, which is turned converts fibrinogen to fibrin. Initial monomeric fibrin is polymerized to form insoluble fibrin by activation of factor 13. This session is powered by Digital Version 2.0, Jyoti Vidyapeeth Women's University. I hope you all enjoyed this session. If you have any query, please mention it in comment box. Thank you.